Have you ever wondered if your skin condition can indicate that your kidneys are damaged? It might surprise you, but when your kidneys do not work efficiently, your skin can show some of the earliest signs. Recognizing these signs early can help you treat kidney issues before they get serious. So, in this video, let's explore 8 skin signs that indicate your kidneys are damaged and what you can do to treat them. Number 1. Xerosis, dry skin. It is a condition in which skin becomes dry and feels rough, itchy, and scaly. It is a very common problem for people with kidney disease, especially those undergoing dialysis. In fact, it affects around 50 to 75% of dialysis patients. Xerosis occurs because kidney disease can disturb how the skin's sweat and oil glands function. The kidneys play a vital role in regulating many body functions, including the skin's moisture balance. However, when they are not working properly, the sweat glands and oil-producing sebaceous glands can become less active. This causes a reduction in skin moisture and natural oils that keep the skin soft and hydrated. Kidney disease can also alter the pH balance of the skin and further contribute to dryness. Moreover, some medications, such as diuretics, which increase urine production, can also increase skin dryness. Symptoms of xerosis include rough, flaky skin that can appear red or irritated. The skin often feels tight and cracked, which causes discomfort. And this can become infected if not properly managed. If you have xerosis, you can manage it through many strategies. First, regularly use softeners, such as thick moisturizers or creams. This can help soothe and hydrate your skin. Apply these products right after bathing, while your skin is still damp, to lock in moisture. Secondly, avoid hot water during showers or baths, as it can further dry out your skin. Instead, use lukewarm water and add bath oils that can provide additional moisture. Moreover, use steroid creams prescribed by healthcare professionals if your condition gets worse. Number 2. Pruritus. It is a condition of very itchy skin caused by long-term diseases like chronic kidney disease. When kidneys are not functioning properly, they cannot filter out waste and toxins from your blood effectively. As these toxins build up in your body, they can cause persistent itching. This type of itching is particularly caused in people suffering from chronic kidney disease, CKD, often called CKD-associated pruritus, CKD-AP, and in end-stage kidney disease, ESKD. The exact cause of pruritus is not 100% clear, but it is suggested that it happens from a combination of factors. One of the primary causes, as mentioned earlier, is the buildup of waste products that the kidneys can no longer properly remove from the bloodstream. Other contributing factors include an imbalance of chemicals or minerals in the body, such as high levels of phosphorus and calcium in the blood, nerve damage, and damage to sweat glands caused by CKD. Moreover, histamine release, a chemical involved in allergic reactions, can also play a role in causing itching. The itching may be constant or come and go, and vary in severity. Some people experience itching across their whole body, while others feel it only in specific areas like their back, face, or arms. The itch can get worse during the night, or in response to stress, temperature changes, or after showering. This constant itch interferes with sleep and daily activities, and frequent scratching causes the skin to break, causing infections. A 2019 study found that up to 84% of patients with end-stage kidney disease, ESKD, experienced pruritus. This study also highlighted that advancements in dialysis have improved this statistic, but it still affects about 40% of dialysis patients. If you are dealing with persistent itching and have kidney disease, the most important thing you can do is consult your doctor. They may suggest moisturizing lotions and creams which soothe the skin and relieve discomfort. They may also prescribe medications like antihistamines or nerve pain medications, such as gabapentin, to ease the itching. Moreover, if you're on dialysis, doctors may adjust dialysis treatments to ensure that toxins are more effectively removed from the blood. Number 3. Rash. A rash is a common skin issue that can occur in people with kidney disease, especially when the kidneys are not functioning well. One type of rash that can develop in people with advanced kidney disease is known as acquired perforating dermatosis, APD. This rash is characterized by small, dome-shaped bumps that are extremely itchy. As these bumps clear up, new ones appear, and sometimes these bumps merge to form rough, raised patches. APD affects a small percentage of patients, typically between 2% and 11%, and is more common among those who are on dialysis. The exact cause of APD is not entirely clear, but researchers believe it might be related to skin irritation from scratching or the buildup of calcium salts in the skin. In some cases, patients with diabetes or other complications may be more prone to developing these rashes. The rash can be accompanied by fluid-filled blisters, which may crust over, and areas of thickened, darkened skin. Symptoms of rashes from kidney issues include itchy, raised bumps or patches that can appear on various parts of the body, such as the arms, legs, and torso. The skin may also feel dry, tight, or cracked. Repeated scratching due to itching can worsen the rash and lead to skin sores or infections. If you have kidney disease-related rashes, apply topical treatments like moisturizing creams and ointments to hydrate and soothe the skin. Emollients help lock in moisture, while analgesic creams reduce itching. For more severe cases, systemic medications may be necessary. Consult your healthcare provider to ensure proper treatment and avoid complications. Number 4. Blisters. Blisters are fluid-filled sacs that develop on the skin, and they sometimes appear in people with end-stage kidney disease. They often start as small, clear bubbles filled with fluid, but grow larger and become more serious over time. The primary reason blisters occur in kidney disease is related to the body's reduced ability to remove waste and toxins. When the kidneys are not functioning properly, harmful substances build up in the bloodstream and interfere with the skin's normal barrier functions. This disruption causes the formation of blisters. Additionally, blisters sometimes result from a condition known as bullous dermatosis, which is linked to kidney problems and involves the development of these painful skin sacs. Symptoms of blisters include fluid-filled bumps that may appear on areas prone to pressure or friction, such as the hands, feet, and arms. As the blisters heal, they often dry up and form a crust. In the healing process, scars may develop at the site of the blisters. The affected skin might also experience redness, swelling, and discomfort. If you have blisters due to kidney issues, treating blisters requires careful care to prevent infection and promote healing. Keep the affected area clean and protected with bandages or dressings. Topical treatments like corticosteroids can help reduce inflammation, while antibiotics may be necessary to combat any infections. If the blisters result from medication side effects or dialysis complications, consult your doctor. They may adjust your treatment plan by changing medications or modifying dialysis procedures. Monitoring and addressing the underlying kidney issues is key to preventing further blister formation and complications. Number 5. Changes in skin color. When kidneys are not working properly, it can cause changes in skin color. These include an unhealthy pale complexion, a grayish hue, or a yellowish tint. Sometimes, the skin can darken in certain areas, or develop yellowish bumps and deep lines, especially if there has been frequent scratching due to itchiness. The yellowing of the skin, also known as jaundice, occurs when the kidneys fail to filter out waste products effectively. This is often seen in more advanced stages of kidney disease and is caused by the accumulation of substances like urobilin, which gives the skin a yellowish appearance. This type of discoloration can be accompanied by other symptoms of kidney failure, such as nausea and tiredness. Paleness, or a loss of color in the skin, can also be a sign of kidney issues. This usually happens due to anemia, which is common in people with chronic kidney disease. Anemia occurs because the kidneys produce less erythropoietin, a hormone that helps the body make red blood cells. Fewer red blood cells mean the skin can look paler, particularly noticeable on the face and the palms of the hands. In some cases, kidney disease can cause a condition called uremic frost. This happens when urea, a waste product, accumulates on the skin's surface and forms a white, powdery substance. This is more common in severe stages of kidney disease and is a sign that the kidneys are struggling to remove waste from the body. Treating these skin color changes often involves managing the underlying kidney condition. This may include medications to address anemia or dialysis to help remove toxins from the blood. Addressing these issues can improve the skin's appearance and help alleviate other related symptoms. Number 6. Swelling and puffiness. Swelling and puffiness, also known as edema, occur when excess fluid builds up in the tissues. This happens in various parts of the body, but it's most commonly noticed in the hands, feet, legs, and around the eyes. Swelling makes these areas appear larger or puffier than usual. The main cause of swelling in people with kidney problems is the kidney's reduced ability to remove excess fluids and sodium from the body. When the kidneys are not functioning properly, fluids can accumulate and cause swelling. This is particularly common in the lower parts of the body, like the legs and feet, due to gravity pulling the extra fluid down. Another factor contributing to swelling is the imbalance of proteins in the blood. Kidneys help regulate the levels of proteins like albumin. When they are damaged, they might leak proteins into the urine, which can reduce the protein levels in the blood and cause fluid to leak into tissues, resulting in swelling. Symptoms of swelling include puffiness, tightness in the skin, and a feeling of heaviness in the affected areas. In severe cases, swelling makes it hard to move joints or feel uncomfortable. If you have this condition, treatment usually focuses on managing the underlying kidney condition. Your doctor might recommend medications to help reduce fluid buildup, such as diuretics, which help the body get rid of excess fluid. They might also suggest dietary changes, like reducing salt intake, to prevent further fluid retention. In some cases, adjusting the dialysis treatment, if the person is undergoing dialysis, can help manage swelling. Moreover, elevating the swollen limbs and wearing compression stockings can also be helpful to reduce puffiness and improve circulation. Number 7. Calciphylaxis, calcium deposits. It is a serious condition in which calcium builds up in the skin and small blood vessels. This condition often occurs in people with severe kidney disease, especially those on dialysis. In calciphylaxis, when calcium and other minerals start to build up in the blood vessels, they damage blood vessels and reduce blood flow to the skin and other tissues. The primary cause of calciphylaxis is an imbalance in calcium and phosphorus levels in the body, which is often seen in people with advanced kidney disease. When the kidneys are not working properly, they struggle to keep these minerals in balance. This imbalance can cause the formation of calcium deposits. Symptoms of calciphylaxis typically start with painful, red, or purple patches on the skin. These patches can turn into hard, nodular lumps and eventually break down, leading to open sores or ulcers. The affected skin may look and feel painful, and the sores can be slow to heal. In severe cases, the condition can cause infections and even tissue death. Treatment for calciphylaxis involves addressing the underlying cause of the condition. Managing calcium and phosphorus levels in the blood is crucial. Doctors may prescribe medications to help balance these minerals, such as phosphate binders or medications that lower calcium levels. In some cases, treatment may also involve addressing other factors contributing to the condition, such as managing vitamin D levels or improving dialysis techniques. Patients with calciphylaxis need to take special care of their skin to prevent infections and promote healing. This includes keeping the affected areas clean and protected and following any medical advice on wound care. Proper management of kidney disease and regular monitoring can help reduce the risk of developing calciphylaxis. Number 8. Nail changes. Many changes in your nails can indicate that your kidneys are not functioning efficiently. These changes often include changes in color, texture, and overall health of the nails. One common change is a discoloration, where the upper part of the nails turns white, while the lower part remains normal to reddish-brown color. This condition is known as half-and-half nails, and it occurs due to imbalances in the body's mineral levels. Another important change is pale or yellowish nails. This is often caused due to the accumulation of waste products in the blood when kidneys cannot filter this waste efficiently. The nails might also show white streaks or bands, known as Muherka's nails. These bands appear due to reduced blood flow to the nail bed and can indicate severe conditions like hypoalbuminemia, a common issue in advanced kidney disease. Nails can also become brittle and prone to damage. This brittleness is often due to the buildup of toxic substances in the bloodstream, which affects the strength of nails. If you notice any of these changes in your nails, consult your doctor. They can help you determine the best course of action and treat them by addressing the underlying kidney issues. Managing kidney disease through medications, dietary changes, and dialysis can help you stabilize the mineral balance and filtration process in your body and improve your overall nail health.